Hello, thank you for joining us today. We're so happy to have you here. We are going to be talking about acupuncture from preconception through postpartum care. For those of you who don't know me, my name is Sadie Minkoff, and me and my team at Sage Acupuncture specialize in reproductive health from preconception through pregnancy here in Austin, Texas. So let's dive in. I realized that so many people aren't aware of everything that acupuncture can offer them through the reproductive years. So this is going to be an overview of how we at Sage Acupuncture support reproductive health. How does acupuncture work? So to begin with, it's important to recognize that acupuncture is one modality within the context of East Asian medicine, which is a complete system of medicine that has been utilized for thousands of years. Of course, it's a very gentle, elegant intervention, but it's only one aspect of our program at Sage. And what acupuncture does is stimulate the body to elicit a very specific physiological response. Our bodies, in their wisdom, are always responding to our internal and external environments and sort of deciding how best to keep us in homeostasis or balance, right? In health as opposed to disharmony. So acupuncture does just that. It's been shown to support increased circulation, modulate the immune system, the endocrine system, support the nervous system and all of those stress hormones. So there are many aspects of our health that can be supported through acupuncture. Preparing for conception and supporting fertility. So we are looking at you as a whole person, not just isolating the reproductive system and focusing solely on that, but really working on your health overall. So that begins with what we assess is nutrition. Are you getting everything you need in from your food? Is your body utilizing it properly, transforming it into usable energy? And is the waste being eliminated efficiently? Movement is key to health, which goes without saying. But when we're talking about reproductive health specifically, you can actually over-exercise or under-exercise. So to give you a sense of what that looks like, under-exercise or being sedentary has been shown to be detrimental to fertility, but also over-exercising. We know that athletes stop menstruating, so it's really important to keep our goal to be consistent exercise, but not the most intense exercise. So that actually is about 50 to 70% of your maximum intensity, maybe 4, maybe 5 times a week. So walking, yoga, swimming are all great options for keeping in that zone. A nice rule of thumb is that if you can hold a conversation at your maximum intensity, then you're good. You're in a good place. If you can't, you're probably overdoing it. Rest and sleep. This is when our body repairs. It's when we heal, and it's a time of day when our hormones are most active. So make sure you get, believe it or not, 8 to 9 hours of sleep a night for optimum fertility. And then if you're struggling with insomnia, we have a lot of support tools, including acupuncture, that can help you. Stress management, of course, this is easier said than done. My feeling is that incorporating tools that are sustainable and workable in your life are what we're really going to see change with and transformation. Sort of like the water on the stone. We continue to introduce small, really workable things into your life, and then all of a sudden we feel like we're in a much better place. Supplements and herbs are a key addition to reproductive health. It's very, very hard to get absolutely everything we need from nutrition. Of course, that's where we begin. But there are some really good and very specific supplements to support reproductive health. I think that it's really important to also work with someone who's knowledgeable about these things instead of just go online and try to do your own research, because we want to tailor them very specifically to your individual needs. Okay, so fertility health concerns that we often see include things like advanced maternal age. This is a tricky one because we have people in our practice get pregnant really every day that are considered advanced maternal age. And that's sort of a horrible phrase. We don't want to be naive. Age definitely impacts reproductive health. But with acupuncture and the right guidance, we can, in fact, do things like increase circulation, which diminishes with age, and we can sort of gain back some of what we lost there. Polycystic ovarian syndrome, or PCOS, is an inflammatory condition as well as a metabolic issue. So this is when ovulation may be delayed due to there being a waxy coating covering the ovaries, and the hormonal communication that's triggering ovulation or growth, follicular development, is gunked up. It's like trying to talk, underwater or something like that. So we're going to really focus on nutrition and exercise and lifestyle here, as well as the acupuncture, to clean up the system and help facilitate not only a strong ovulation, but a healthy pregnancy. Endometriosis is also an inflammatory condition, but this is due to the tissue from the endometrium, or inside the uterine lining, being outside of the uterus in the abdominal cavity, which it should not be. And the body responds to that with inflammation. So we want the system to be able to clean up that tissue that is not where it should be, but also calm the immune system and facilitate reproduction that way. Malefactor is probably the most underlooked at aspect of fertility. And in fact, it is 1/3 of reproductive issues. 1/3 is female, 1/3 is male, and 1/3 is a combined male and female issue. So important. We have seen over and over again where we've sort of done everything possible to get the female person in optimal health, and then it's not until we see the male that we really get the results that we want. Also, male fertility overall, globally, over the last several decades, is declining rapidly, which is a really interesting and sort of scary phenomenon that's happening. So we really need to look out for what we're exposing ourselves to in our environment, what we're putting in our bodies, and how we are managing our stress. So, malefactor infertility. Unexplained infertility is just a tricky one. It's so challenging because, you might have done all the tests and yet you're coming up with no answers. Chinese medicine or East Asian medicine is a really great addition to your toolbox in this case, because we are looking at your body holistically, every system, and how it impacts your reproductive health. So we can sometimes discover disharmony that is sort of under the radar of Western medicine and attend to that. IVF support is a big part of our practice at Sage. Studies have shown that there is great success and increased success with adding acupuncture to the IUI or IVF process. Pregnancy. So you're finally pregnant, or pregnant again in the case of miscarriages. And you're in that delicate first trimester. So we are really going to support a healthy, strong pregnancy all the way through this first 12 weeks. In fact, our fertility program takes you through your first trimester, because it's just a lot of a transition. And if you've had any miscarriages in the past, we want to really attend to your health at this point. Of course, we treat a lot of those uncomfortable early symptoms like morning sickness very effectively, and anxiety. This is a big transition. And again, especially with pregnancy loss, it's one of the most challenging things that you can go through. And it's not something that is supported, or our communities often don't know how to support us through that. We're sort of expected to just get up and move on and go to the next thing. So acupuncture is a great way of resetting your system and and feeling like yourself again. So discomforts, this goes all through pregnancy as you get bigger and there's a baby pressing on some nerve, or you have back pain, your center of gravity is changing. Acupuncture is a beautiful way to release tight muscles and support any discomfort, again, like carpal tunnel or back pain. Breech presentation is when the baby is not in the optimal position for labor. So the key here to remember is that any time past 34 weeks gestational age is when you want to address breech presentation. So any time past 34 weeks, if your OB or your midwife says, oh, your baby is breech, you call us right away. And we have a really gentle protocol that mostly is done at home yourself to stimulate the baby to move into place. And it's very safe and gentle. The sooner you get in, the better when the baby is small enough to move, but big enough to stay put. And then our labor preparation treatment series starts at 36 weeks. This is a beautiful way to sort of glide into the laboring process. And we teach you some really nice acupressure points to use yourself during labor as well. 36 weeks, once a week treatments has been shown to reduce interventions like cesarean sections. If you do end up needing to be induced, it's that much more effective with this preparatory phase. And women, people report better experiences of labor with these preparation acupuncture treatments. And then mother warming is a really nice postpartum treatment that you receive. And at this point, we really recommend that people just get to know their baby and you stay home. But if you have had any problems with milk production or a lot of bleeding or baby blues, or need any additional support, that you absolutely come in and utilize acupuncture. But back to mother warming, it's a really nice technique where we warm the body, increasing circulation and encouraging the digestive system to regain balance. And it feels really, really good and just helps that healing process postpartum. Okay, so what to expect from a treatment with us is that we are going to sit down with you, usually via telehealth, and create a plan. So we're going to talk to you about your health history. We're going to answer all of your questions and get you ready for your first acupuncture visit. When you come in, we do the acupuncture and let you rest in a beautiful space for about 30 minutes. The acupuncture is something that people really do look forward to. It's a feel-good experience. Most people even fall asleep. So that's one thing that I think people are really curious. How does this feel? As it is an interesting process. But it resets your system. People tend to be more vibrant, more energetic, and less stressed. So any aspect of your life, of course, all of those things can help, but particularly during the reproductive years. So thank you so much for listening and joining me today. If you would like to get in touch with us or you have any questions at all, please feel free to look at our website, reproductiveacupuncture.com, or reach out. Take care. Bye-bye.